Those are the two ways we can get rid of this nasolabial bulb. And third thing, we can remove the buccal pad fat from inside. But the pad fat will only cause a decrease in 2 millimeters, maybe minimal. This will make a big, because this whole thing, if you move it by 10 millimeters, this will get inside quite a lot because the muscles pull everything. So by doing this and by doing this, you will get the maximum improvement to that. And at the same time, so if you look your face from the side, it's like convex. Yeah. So we can give you a straighter profile. So a straighter profile enables this prominence not to be visible without changing your racial characteristics. So we're going to keep your, like, I'm not going to try and make you a Caucasian or an Indian or something. We're going to keep you as your original race is, and then just alter the proportions a little bit to address your concern. That's it. But this is the best way to address both. I mean, I've told you the way we can do that.
So there's no way to alter without.
No, we cannot do that because otherwise it'll be a scar here. I don't recommend. It's not a procedure to do. So you have to look. You have to find out why is the puffiness. It's because your bone is small, so the muscles are all bunched up. So the moment this comes forward, everything will start staying in its right place. That's the logic for this.
So that will be the upper and the lower jaw.
No, upper jaw we don't need to do.
Okay.
It'll be the nose.
Oh.
From the side of the nose. Yeah, upper jaw we don't need to do. If we do the upper jaw, what will happen is, how can I say, your face will get slimmer. I don't think you want that, right? Yeah, so don't do that. That's not needed.
And if I just do the nose and see how
Yes, that's fine
it
too.
looks like, and I
Yes.
don't want to do.
That's fine also. Yeah. The options is yours. I mean, I because of based on your complaints, I'm suggesting the kind of procedures that will give you good improvement. And then I'm also saying this will not give good improvement. Like you want an upper jaw, I said no upper jaw. Like so, then in this you can choose. I mean, um, also you can ask my team to tell you the costing because each procedure will have a costing. So based on the costing, you can decide to have none or one or two or three procedures. So you remember I did say three things. One is for your middle third of the face, and one is this to pull this thing down, and the buccal pad fat. So you can talk with them, and also they give you a slight discount if you go for a second procedure after the first one, because the anesthesia is the same and the medications and the room rent is the same. Yeah, so but then you get an idea. Once you get an idea, you can tell them, okay, I want to go only for this first or this and that or something like that. All right, and whatever it is, yeah, I think the time you have is enough, just enough types because today is already the 18th and you're going to go on the second. So we're really on a very, very tight schedule, which means what we have to do is, so we'll have to, once you decide on what procedures you want, you can tell my team that you want this, and then they will run a blood test for you. Then they'll do an ECG and get your anesthesia clearance. If that's all done, let's say by today afternoon, then at least by tomorrow we could plan your procedure. Otherwise, we lose more and more days, and then you already don't have, you don't have enough time to get back to the US. And the longer you get here after surgery, I mean, your recovery is going to be nicer and everything. All right.
Okay.